for me, plastic surgery, choosing plastic surgery was for a number of reasons. At the end of school, really, it was my interest in science and really wanting to do something with my hands that was a bit procedural, and I really liked art at school. So I decided to do medicine really for, look, I have an interest in science, I think I might be good at this, but not really knowing a lot more about that. As I went on, I got exposed to some other specialties, and plastic surgery was one of them. And what I really liked about that was it was attention to detail. It was creative. We do head-to-toe surgery. We get to work with every single specialty. And it was like you'd committed to a profession, but you hadn't. You really could do a whole breadth of surgery, and that's really what attracted me. I started in private practice about 3 years ago. So I finished my training at the end of 2014. That was training in plastic surgery. And then I went overseas for 1.5 years of training. So I did a year in the United States and 6 months in Canada. And then when I came back 3 years ago, I knew I always wanted to work in a public hospital, but I always wanted to have a dual practice. I wanted the balance of public-private work. And I think, again, that brings a lot of variety to my job. So on the reconstructive side, I do a lot of skin cancer work, hand surgery, reconstruction of different wounds with other specialists, and really just trauma, anything. And that could be hand trauma, other trauma, facial trauma, things like that. In private practice, I actually get to do a fair breadth of some of that reconstructive work as well, and then with a flavour of some cosmetic work, which I focus a lot on breast body work, but I do face and other parts as well. Our interaction with BOQ Specialist, I think, made our dream sort of come to fruition, and we found them to be very receptive. And more beyond that, they took sort of almost a personal interest in your well-being and what you wanted to achieve. And to be honest, the financial side of things, they always said, not a problem. It was more the vision and how big you wanted to make it, and they wanted to work with you to make it obviously a realistic sort of end goal, that you weren't thinking too small and you weren't thinking too big, that there was something that had some capacity to grow, and we really liked that. It was sort of having a partner with you to make your practice grow, and it was great. It was almost like you were dealing with a bank.
Generally, when clients are setting up practice for the first time, they want to be able to fit out and equip their premises, which is something that we do. They may also want to purchase the property, and that we've got the ability to lend them 100% funding for that. Something that's very topical at the moment is clients purchasing their practice premises in their self-managed super fund, which has a lot of benefits. Also assisting them with their working capital requirements when they're first starting out. We also put them in touch with various industry partners that we've worked with for many years, who specialise in the medical, dental and veterinary space. So for us, helping clients along that journey is really important.